Hello, I'm Mark Rickenbach. I'm a GP and a visiting professor at Winchester University, and I want to talk a little bit about confidentiality in primary healthcare. I just mentioned that there are several levels of confidentiality to consider, and the first one is the absolute confidentiality that you would get if you keep everything to yourself and don't tell anybody. It doesn't really help you if you want to solve problems and move things forward. So the next level to think about is spoken confidentiality, where you might talk to one other person and they may help you move forward with your problems, but hopefully not divulge those things to anybody else. The next level of confidentiality in healthcare is written confidentiality, and in that case you have to be aware that there's a paper record or a computer record which could be shared with others, and obviously a paper record would be more secure than a computer record, provided it's in the same building. You have to think about data protection and things like that for control of the data. The next level to think about from a healthcare point of view is organisational confidentiality. And in this case, the group or organisation that shares your records is meant to contain those records within their group and not share them with anybody else without your explicit permission. And then the next level of confidentiality would be the professional confidentiality, and that is that a group of people who are working in the same area, such as general practitioners, may discuss your situation, perhaps discuss it in an anonymised way without mentioning your age or sex or anything that relates to you directly, and that would help them resolve some of the problems that you're facing. So those are the levels of confidentiality that we face within healthcare, and in particular primary care. And if you want more information, you can go to www.docric.co.uk, and this is the associated website with this YouTube video. So thank you very much for listening. I hope that was of interest. Hello, I'm Mark Rickenbach. I'm one of the visiting professors at Winchester University and a general practitioner. I just wanted to talk to you briefly about confidentiality, particularly in the context of healthcare and primary healthcare. And the first thing is that there's absolute confidentiality, and that's really only achievable if you don't speak to anybody, because if you don't speak to them, they can't pass it on. But you can't share and learn from others if you do that. So the next thing is the spoken confidentiality, and spoken usually one-to-one, and if you trust that individual, they hopefully will not pass on that information, and that will help you move things forward without necessarily sharing information with others. The next level is written confidentiality, in which case there's going to be a record somewhere, it might be written in paper or on a computer, about what was said. Now, if it's a paper, there's less chance of that passing on. If it's written, then on a computer, then it would be related to data protection, and there will be some control over where it goes. The next thing to think about in healthcare is organisational confidentiality. In this case, it's only shared information with those who need to know about it relating to your healthcare. It might be that group of people within your general practice where you're registered. And those people understand about confidentiality and know that they must not breach it outside the building environment, outside the area of healthcare for you. The next level of confidentiality is professional, and in this case it may be information that's shared within a group of people, such as doctors, to try and help move forward the particular problems that you're facing. And in that sort of setting, they wouldn't necessarily talk about your age or sex or anything that identifies you, certainly not your name, and that would then enable them to help decide the best plans to move it forward. So these are the levels of confidentiality, and you can ask your own doctor about the particular level you want and prefer, and it may be you say, I just want this to be between the two of us, or it may be you understand that this could be shared within the team that's looking after you. So, just to recap, there's absolute confidentiality, spoken confidentiality, written confidentiality, then organisational and professional confidentiality. And those levels to think about when you're seeing your doctor as a patient, or when you're a doctor looking after patients. And if you want more information, you can go to www.docrick.co.uk. That's DOCRICK. Thank you very much for listening.